This tutorial is part of a series of videos about reproductive toxicology. In this video, we'll be focusing on the toxic effects of the reproductive system in men. We're a third year group studying pharmacology in UCD in Dublin. We have some other resources available, such as a website with lots of different things on it, and there's an app that's available to download as well. We develop videos about fetal and female toxicology as well, and there's another video that gives a summary about the reproductive system itself, which you can find by clicking here. In this video, we'll be focusing on two main toxic effects experienced by the male reproductive system. The first being lead and the second being radiation. Radiation itself isn't strictly a toxin, but it can elicit toxic effects on the body. Acute radiation syndrome, also known as radiation toxicity, is when a person is exposed to high amounts of ionizing radiation. Exposure to radiation impairs luteinizing hormone signal transduction. This effect on signal transduction in the Leydig cells of the testes interrupts steroidogenesis. This interruption causes a decrease in serum testosterone levels. Experiments involving this are usually carried out in rats with levels of 6 or higher of gamma radiation, causing an interruption to steroidogenesis. Exposure to radiation is increased through the use of mobile phones. By storing a mobile phone in your pocket, the levels of radiation are increased in a localized area. This can result in increased mitochondrial reactive oxygen species being produced in the Sertoli cells of the testicles. This interrupts gametogenesis and can also cause infertility in men. The second thing that we'll be looking at today is lead. Exposure to lead usually occurs in the environment. Lead is a soft, malleable metal that can be found in some foods and can be exposed to in the environment in such things as lead paint. Toxic levels of lead in the reproductive system in men is anything over 40 micrograms per deciliter. Patients present with symptoms such as lethargy, vomiting, irritability, loss of appetite, and dizziness. More severe symptoms include the development of ataxia, reduced consciousness, which can eventually develop into coma and ultimately death. Sterility in the reproductive system in men is mediated through the Sertoli cells. Toxic effects of steroidogenesis occur in the Leydig cells. This means that lead alters both the hormonal axis and spermatogenesis. This leads to oligospermia, which is low sperm concentration in the semen, increased spontaneous abortion, and abnormal fetal development. Hypothesized that lead can compete for the same mechanisms that calcium does. This can lead to cyclic AMP signaling disruption.